Welcome to Cumulus Community, a weekly public affairs show spotlighting the most pressing issues affecting our community. Now, here's this week's host.
Good morning and welcome to Cumulus Community. This is Amy Ponce. I hope you're having a lovely morning so far. Today I have the chance to speak to Dr. Healey, Director of Chest Radiology, and we're going to chat a little bit about the Partnership to Reduce Cancer in Rhode Island. Good morning to you.
Good morning, Amy. Thank you so much for having me.
Well, no, thank you. I mean, we are always looking for great opportunities to talk about everything local around here and, of course, always ways that we can reduce and prevent cancer here in the Ocean State and beyond. Now, you are affiliated with Partnership to Reduce Cancer in Rhode Island, so why don't you tell me a little bit about that?
Yeah, sure. This is a great community organization, really dedicated to improving the health and lowering deaths from cancer in Rhode Island. It's an honor to be associated with this organization, and we were able to create something called the Rhode Island Lung Cancer Screening Task Force, which is doing incredible work in regards to lung cancer. I don't think most people know lung cancer is the biggest cancer killer in the United States for both men and women.
Okay.
When I ask men what is the biggest cancer killer, they think about prostate and colon. When I talk to women, they always say breast cancer is the biggest killer. But actually, lung cancer kills more people in the United States and in Rhode Island than breast cancer, colon cancer, prostate cancer, and lymphoma all combined. So it's pretty a dangerous disease. And our effort is really to get the word out that this deadly cancer is preventable, especially in people who have a history of smoking.
Lung cancer versus breast cancer, sometimes, and this is just my thoughts, and I'm probably one of those people that, you talk to, and I would seem shocked that lung cancer is more of a killer than breast cancer or even prostate. Is it because symptoms don't present? Because I would assume they would.
Yeah, the thing about lung cancer is when I see patients that have symptoms, and the symptoms of lung cancer may be weight loss, cough. If you cough, you may cough up a little blood. Mm-hmm. Actually, you have a headache. By the time patients have symptoms, it's often at the end stage of disease. Yeah. And once we catch it, when it has spread, the prognosis is very poor. But, it's been about 10 years now that we have good data that CAT scans, done in the right patients, so people who have a history of tobacco use, very mm-hmm. specific criteria, 50 years or older up to age 80, smoked about a pack a day for 30 years. We can do CAT scans and find these very small lung cancers that we're able to actually cure the lung cancer. And it's actually a pretty good cure rate.
So, Dr. Healey, how are you getting the word out to the people, or at least trying to get people who might be, eligible for these tests, these CAT scans? It must be hard to actually have people know in the first place that they should get screened. How are you getting the word out that these are available?
Yeah, Amy, that's a very good question. And it turns out of the eligible population in Rhode Island, so if you look at all the people in Rhode Island who would be eligible for a CAT scan, right now only 6% of them are getting annual CAT scans. Wow. So that's very low. Actually, Rhode Island, that's actually the second highest in the country, believe it or not. Nationally, it's felt only about 3% of the patients are taking advantage of this life-saving CAT scan. Yeah. And I think it's just really people are not aware of the test. And I think, like you said, if somebody's been a big smoker, they say, I don't have any symptoms. I don't have a cough. I don't have any of those things that Dr. Healey talked about, weight loss. But it turns out most of the lung cancers that I find, and I find them every single day, are people that have no symptoms at all.
So is it something that gets brought up at their, when the doctor asks you, your primary, do you smoke, do you drink, do you do this, do you do that?
Yeah, that's absolutely right. Unlike a mammogram where you can just kind of go and get your mammogram, the lung cancer CAT scan, you have to have an order from your primary care doctor, or nurse practitioner, or physician's assistant, and they're going to talk to you about the risks. The risks of a CT scan, the radiation is very low risk. It's actually similar to a diagnostic mammogram. Yep. The risk is, we may find something else. We may find, we scan through the heart, so we may find some problems with the coronary arteries, so like atherosclerotic disease, coronary artery disease. We may find an incidental thing in the kidney or adrenal gland, which may lead to additional tests. So that's the risk of just finding things that, we weren't looking for. I always get this question, how much does it cost? Is it dangerous? How
Right.
long does the test take? It takes about a minute to do the scan or less. It takes longer for the patient to sort of change into the scrubs than it does to do the CAT scan. The study is covered by Medicare, Medicaid, and every third-party payer in the state if the person meets the correct requirements,
Right.
which is the important thing.
Right.
Because it is a screening test, there's no copay.
I feel like now I know why we're trying to get the word out about this, because like you said, if it can be something that's, that you can cure or you can treat as soon as possible to help somebody live, then that's, and then improve their quality of life as well.
Yeah, that's right, Amy. And the important thing is about cancer and screening for cancers.
Mm-hmm.
You don't want to find it unless you can treat it. And the thing about lung cancer is if we find it early, like I mentioned, there are lots of good curative treatments. Some of them are invasive, like surgery.
Mm-hmm.
Some are less invasive, where we can sort of put needles into the tumors and cook them. We call that ablation.
Mm.
And then there are non-invasive ways to treat the cancer. That's called radiation therapy.
Yep.
When the cancer spreads, there's specific drugs, some of which are tablets that can go and kill certain tumors. So that we have a lot of tools that we didn't have when I first started out in radiology about 13 years ago.
Yeah, my aunt had colon cancer that spread to her lung. And she only found it because it was something happened to her skin randomly. And then, they did, like you said, I believe it was a CAT scan and everything. And they found that it had spread. She's okay. They found it early enough. So it's just crazy to think that how, like you said, all these treatments. And this was probably about 15 years ago. So I think her only option then was,
things have really changed.
Big time.
I think when people around our state and around the country, when I give talks about lung cancer and screening for lung cancer, you hear from patients, I don't want to find it because I may need chemotherapy, and my father had chemotherapy and it was torture. Well, I got to tell you, the treatments are much different today than they were 20, 30, or 40 years ago.
Right.
Many of them are very tolerable. Patients do well, and it can really save lives, which is really the goal of our partnership here, is to get the word out. We're trying to find out the barriers. How come we're only scanning 6% of the eligible people in Rhode Island?
Right.
Is it people are sort of ashamed because of their smoking history?
Right.
I'm not quite sure. So one thing that I get asked a lot is, I have a family history of lung cancer. My sister died of lung cancer, but I don't really fit the criteria. Can I get scanned? Or my dad died of lung cancer.
Mm-hmm.
Can I get scanned? Well, the screening study that was done didn't include those people. And the numbers that I quoted, the 6%, don't include family history of lung cancer.
Okay.
But I will say, if you're listening and you have a family history of lung cancer and you have symptoms, cough, a little coughing up blood, some weight loss, that's really a sign you should tell your doctor, I have a family history of lung cancer. I'm worried about it. And in those circumstances, we don't need to do screening, but we can still do a CAT scan.
Yeah, I've had MRIs. I've never had a CAT scan, but I think you had said they're like super fast.
Yeah, the MRI is kind of noisy.
Yeah.
The tube is longer.
Mm-hmm.
You're in there for a while. Some patients may need certain drugs to kind of calm them down because they get claustrophobic. But the CAT scan is so fast. You're in the tube for seconds. I've never had anybody tell me that they couldn't withstand a CAT scan.
Right.
You don't have to go to the hospital. You don't have to, be at any office for very long. I mean, we usually scan our chest scans in 15-minute blocks. So that gives us enough time to sort of change the patient, scan the patient, and talk to the patient a little bit, and then, the next patient's ready to go. So it's a very short appointment.
Well, Dr. Healey, I am so glad that I learned about this. I hope everybody listening will look more into it and know that these scans are available. I just appreciate you taking the time to get the word out.
Yeah, I think this is the beginning of a long journey, I believe. And at this point, we're really just focusing all of our energy on getting the word out.
Okay.
Particularly to communities who may feel they don't have access to care or not know how to go and see if they're eligible for this scan.
Okay.
We're finding that, certain populations in Rhode Island are unrepresented in the patients who are currently being scanned. So we're trying to get the word out to many communities throughout the state who may not even know that this is an opportunity to save their life.
Again, if you want to look more into Partnership to Reduce Cancer in Rhode Island, either how you can help or how you can learn more information on different screenings, especially the one that I talked to Dr. Healey about with the lung cancer screening, you can visit prcri.org. That's prcri.org. And you can learn all about prevention, screening and early detection, treatment, survivorship, and also talk about how you can help, too. The partnership is actually holding its first ever fundraising event this summer, and you can join them for an evening of music, food, and, of course, support a good cause. The date is Thursday, June 15th. It's called Spring into Summer, and you can actually learn more about this. Tickets are limited, so you can get your spot now for just an unforgettable night supporting cancer prevention and survivorship. That's prcri.org, and you can look into their Spring into Summer event, Thursday, June 15th. Dr. Healey, thanks again so much for talking to us this morning.
Thank you so much.
Thank
Have a great
you.
day.
Take care. You too. Bye.
All right.
This has been Cumulus Community. If you are a nonprofit, charity, or community champion and would like the opportunity to speak about your initiative, please contact us at light105.com.